here. That's not what I meant to do. I meant to. So what'll happen? I usually turn my camera off, because I don't want to be a distraction. Um, Hi everybody, people are joining in. I'll just turn my camera off and let you guys have the space. Hey everybody, thank you for joining us early. We're just waiting a few more minutes, giving people a few more minutes to join, and then we'll begin. Thanks. Hey Howard, I was just about to text you. Oh, you just muted yourself. I'll mute you, hold on. There we go. Can you hear me now? Yep, I hear you. I hear you moving your iPhones. We're just giving folks a few more minutes to hop on, and then I will hand the controls over to you. Thank you everyone for joining us online. We're just giving folks a few more minutes to hop on, and yeah, we'll begin. Thank you all for joining.
Can you hear me?
Yes.
Oh, great.
Yes, we hear you.
Oh, it suddenly started working.
Awesome. All right, folks are joining actually at a pretty good pace. Maybe about 3 more minutes, and then we can start. Hey everyone, again, if you're just joining us, we're just giving everyone a few more minutes to log in, and then we'll start. We're just giving folks about 2 more minutes. This is the longest 2 minutes ever. Thank you everyone for your patience. We'll be starting shortly. All right, it's 2:05. That last minute went by really fast. Um, Thank you all for joining us today for another installment of the Damien Ministries webinar series. Today, we are blessed to be joined by Dr. Howard Grossman and nurse practitioner Veronica Holland Barner. We pulled these two individuals together. Well, first of all, let me back up. My name is Kenya Hutton. I'm the program director and administrative director at Damien Ministries. Damien Ministries is a nonprofit organization based out of Washington, D.C. that does HIV testing, food bank, case management, medical case management, nutritional therapy, etc. The reason for this webinar is because as a team, we sat back and we noticed there was a lot of, or there is a lot of conspiracies going on, a lot of rumors, a lot of misinformation going on in the community that could potentially increase our risk. Because we all know we are still in the midst of a pandemic. But we get a lot of information from the news, from different spaces, from different friends. Some of the information may or may not be accurate. So we thought as an organization, what we'd like to do is bring you two experts that I've heard both of these individuals speak before in other spaces, and thought it was great to bring them together. I'm so thankful that you guys agreed to join and do this together to share some information about this COVID-19 thing we all hearing about and answer some questions from the audience about whatever. I've gotten a number of questions today. So my colleagues on the line, they have questions. So thank you to both of you for agreeing to do this. What I'm going to do is we want to start off with a presentation, right? Just to get everyone a general knowledge and idea of what COVID-19 is, the virus, how it spreads, etc. So what we're going to start off with Dr. Howard Grossman. If you can see your screen, I will hand it over to you.
Great. Well, thanks so much. I really appreciate your kind words and thank you for inviting me. So I'm gonna, let's see if I can share my screen. There we go. Okay. I don't think the purpose of this is to overwhelm people with medical information, but I think hopefully we are going to talk about how we can give you some good, coherent information and also tools for living with this epidemic, because I think that, Veronica and I, that I would probably have experienced the same thing, that people just have so much information coming at them that they're just looking for clear answers, and we're not getting that from the media or from the government. So I have some take-home messages that I think are important for people with any medical problems, but especially people who are living with HIV, and that's kind of where the world I come out of. One, it's really important that people stay engaged in care, that we find ways to ensure that people can take their medications and that they can do what they need to do to take care of themselves. Practicing social distancing is important. We'll talk about that more, and wearing masks and hand washing. And basically, again, this idea, how do I deal with all this information? So I wanted to talk a little bit about how a lot of us know HIV, and this is a very different virus. But these epidemics have some comparisons and then some things that are completely different. Everybody wants to talk about what's my risk from complications from COVID-19 and how should I protect myself? And again, how do I deal with all this data? So for people in the audience who know HIV, it's taken 35 years to develop this picture and it keeps getting more and more complicated all the time. But basically, the key points with HIV are that you have a virus that attaches to the cell, the genetic material gets in, it's copied from an RNA uh, to a DNA. But then the key with HIV and other retroviruses is that they integrate into our own genetic material. So they reproduce along with your cell's genetic material. And then over time, they may start to produce new viral particles that bud off and then go on to infect new cells. And the drugs that have been developed over the years work at different points in this life cycle. This is a cartoon of the SARS-CoV-2, the COVID-19 virus. This virus attaches to a very different receptor, the ACE receptor, which is something that we have on many, many, many cells, and that we have high blood pressure medications that target this particular mechanism. It fuses, it gets in, it copies itself, but it does not go into our genetic material. Okay, so this virus takes over your cell's manufacturing abilities. So you see here, this is what they call the endoplasmic reticulum, the Golgi apparatus, basically the factory of your cell that makes proteins and things like that. And this virus is able to take it over, make new viral particles that then bud off in a different way. And so it doesn't get into your nuclear material. So the most effective drugs that we have in HIV are the so-called integrase inhibitors. This virus doesn't integrate, but this virus does use some things that some of the drugs that we have for HIV also attack, like the nucleoside analog inhibitors may have some effect here where the virus is copying itself. It had the proteases may have some effect. So these are drugs that people recognize from HIV may have some effect, but our most powerful tool doesn't. So when we talk to people about with HIV, we know that there's increased risk with certain comorbidities. So diabetes, high blood pressure, cardiovascular disease, chronic pulmonary disease, smoking, and obesity. There is limited data out there that seems to show that people living with HIV are at no more susceptible to COVID-19 and have a similar disease course to people who are HIV negative, no matter what their T cell count is. Now, we don't know why this is, but in fact, there's some intriguing information that people living with HIV may be even less susceptible for some unknown reason. Now, there's a big cohort of patients in Spain, and they remarked on this first, but then other people have sort of noticed the same thing, that people with HIV are not getting sick any faster than anybody else. And there's a study out of Hong Kong that used two drugs that we use for HIV, plus a drug that we use for multiple sclerosis that helps to suppress immune response. And that actually had some impact on how quickly people recovered. So there is some idea that some of the drugs that we have floating around already may be able to have some impact. But the big thing I think for everybody is that having these other comorbidities, these other diseases, is what really raises your risk, not HIV. Really important for everybody with any kind of illness, any kind of chronic medication use, to make sure that they have at least 30 days of medications and preferably 90 days. And if an insurance company fights you on that, you should appeal it. Do not take no for an answer. We're in a crisis. The Medicare is approving the use of 90-day prescriptions, and so should all the insurance companies. So just don't take no for an answer. which is usually a good thing to do with insurance companies anyway, because it's basically a game and you have to push back. It's important to stay up on all your vaccines, influenza vaccines, pneumococcal vaccines to prevent pneumococcal pneumonia, the most common kind of bacterial pneumonia, and shingles. We don't want to confuse COVID-19 with other diseases that may mimic some of the symptoms like the flu or pneumonia, but community-acquired pneumonia. It's important to follow the CDC guidelines about social distancing and hand hygiene and mask. And I think every one of us probably saw the news reports from this past weekend of people gathering in huge groups without masks, without staying apart from each other. It's a scary time. So again, make sure to have 30 days of meds. Best is 90 days. Sometimes just switching to the mail order pharmacy that insurance companies want you to use will let you get a 90-day supply. People shouldn't change their medications in the middle of lockdown. So if you're able to see your provider, then maybe that's a good time to talk about changing medications. But otherwise, if what you have is working reasonably well, it's probably a good idea to stick with it for now. It's very important to know that if for whatever reason you go to the hospital, bring all your medication. Some of our patients living with HIV are on medications that are not formulary in an acute care hospital. So I mentioned a couple of them in this slide, Trogarzo, Egrifta, Serostim. These are just examples of drugs that are not going to be available as a rule in the hospital. Very important to bring all your medications with you. It's also important to talk to your provider or your pharmacy ahead of time to find out if I need to go to the hospital, how will I make sure to get a supply of these drugs and have that all worked out. Patients who may end up on a respirator may need liquid medications. So again, are there liquid formulations of my medications? These are questions you can ask ahead of time if you're concerned that you might ever need to go to the hospital. If you're on a study, make sure that you've worked out with the study coordinator how you're going to get the study drugs. So someone other than you should be aware that you're on a study and figure out how you will get those medications in the hospital, or if you're sick at home and can't get out to get them. Doctors and nurse practitioners and other providers love to get labs on people, but is it always important? That's the question to ask. So if you're in an area with a lot of infection going on and you don't want to leave your home, then ask the question, do I really need a face-to-face meeting? Can we do this by telemedicine? Do I have the equipment? Does my phone work with it? A lot of times you can do telemedicine right over your phone, but are you set up to do that? And really think about, is this visit completely necessary? Are the labs completely necessary? Or can I wait for the next time when maybe things will be a little bit more under control? Other considerations I think that are very important is food, housing, transportation, and childcare. I think we're realizing how many holes there are in our healthcare system, and suddenly people's options are so much more limited. So making sure that all of these things are in place is very important. If people lose insurance, it's important to know, especially with HIV, that there are patient assistance programs to cover uninsured patients. So there is no reason to stop medications. You just need to ask for help, whether it's from Ryan White, from a local AIDS service organization. People will help you find medications. In addition, if you're on non-HIV medications, there are many patient assistance programs. If you look online or if you talk to a local organization, they can help you get your medications. Many of the companies are stepping up and helping people to get medicines. I like to throw this in just as my personal message, because I think there is a one shining light, other than the fact that they're hopefully going to fix our healthcare system. The other shining light is that we've now had 2 to 3 months where people are not having a lot of casual sex out there, where there aren't really venues for it, where people have been staying home. And this would be the perfect time to test every single person who is willing for sexually transmitted infections and treat as many as possible. We will never have this chance again where we've had this 2 to 3 month break, and we can maybe really break the back of the sexually transmitted infection epidemics that have been running around this country. So, how do we cope with this stuff? I think it's very important to realize that what we're watching is science in development in real time. We're used to saying, oh, there's a study that shows this, or there's an algorithm for treating that. This is how you go step by step, yes, no, to treat a disease. We don't have any of that with COVID-19. We are learning as we go. And so the news can be very, very confusing because there is this huge flood of data. Now, the same thing happened in the early days of the HIV epidemic, but it wasn't coming nearly as fast. I mean, realize in a matter of 5 months, we know the structure of this virus, we know its life cycle, we know points of attack, we know a lot that in the early 1980s, we didn't even have the science to figure out. So you are being flooded with huge amounts of data as it comes out of the lab. And we need to be able to process all this. So listen to everything that you hear, but listen with a critical ear. Don't run after every piece of good and bad news. They put out a press release. We're having science by press release. They put out a press release that 8 people developed neutralizing antibodies with a vaccine. And suddenly what happens? The stock price goes up by 30%, but there's no data. Nobody's seen the data. Nobody's looked at it. We have a president who's running around telling people to drink bleach. Hopefully, I think most people are smart enough to know that that's not something you should listen to. But remember, what I've always taught my patients is if you hear strong voices on either side, the truth is going to be in the middle, and live in that middle space and you'll be a lot happier. So staying engaged in care, really important. Making sure that you're prepared with medications. Practicing social distancing is helpful, but I also want to say the 6-foot rule, I have some questions about. The 6-foot rule was developed when people weren't wearing masks. So if you ask me, what we all need to do and what I follow is, I'm going to the grocery store, I use hand sanitizer before I go in, I wear my mask, I use hand sanitizer when I leave. Hopefully there's nobody coughing and sneezing. And if nobody's coughing and sneezing and everybody's wearing masks, how much extra benefit do we get staying 6 feet apart? That's a big question that we don't really have the answer to. But I think the important thing is that hand washing and hand sanitizing, and I'm old enough to have had a mother who told me when I came in from the street to wash my hands. And I think that's when you go home, wash your hands with soap and water. I think those things will help keep people safe because we're talking about practicing harm reduction. You cannot eliminate risk, but you can reduce risk. So for people who've lived through the HIV pandemic, we kind of know how to do this, I think. We know how to listen to the science. We know how to figure out who's blowing smoke, who's just a talking head, and who may be giving us useful information. And we know that harm reduction is the key to keeping people safe. And I think we need to keep those lessons in mind. Thanks.
Awesome. Thank you so much for this. So many things that you said that I, just like, yes, the talking heads. Somebody's right, but who is right? So thank you for that. So what I want to do, it seems like we have some folks that are very engaged already. I want to go ahead and introduce Veronica Holland-Barner, a nurse practitioner here in the area of the District of Columbia. I heard her speak through the Institute of Public Health and Innovation. And again, I said, yes, I want to have you on my webinar. So I'm going to open the floor now to Veronica if she had anything she'd like to add. And then I'm accepting questions. Feel free to use the Q&A box on the bottom of your screen, or if you would like to speak live, raise your hand, do the raising hand option in the chat box, and I will unmute your line. So you have the chat box or you have online. So I'm going to hand it over to you, Veronica, if you have anything you'd like to add.
Well, no, I don't have anything that I'd like to add. Dr. Grossman pretty much covered everything. Just, you can open it up to questions and answers, and I think that would be best, because then we will find out what people really want to know, or if it's anything that they're lacking in knowledge on.
Well, Veronica, I'm going to ask a question of you, because you're right in DC, and DC has been doing a magnificent job of handling a difficult epidemic. But all over the country, we're seeing that African American people are disproportionately affected by this. And I'm wondering we've heard so many people with so many theories, what you think is going on more than anything else?
As far as with the information that's coming out?
Well, no, what you're feeling is what you're seeing, what you think the root of this problem is. Why are people of color in this country being so disproportionately affected?
That's a double-edged sword. With that, I feel that we are not, we don't have the access to all the information. A lot of us do not get the information firsthand. We get it by word of mouth from friends, as opposed to reading it for ourselves in research studies, or getting out and talking with our own healthcare professions. A lot of people usually get it word of mouth from my friend told me, or this is what I heard last night on the news. So it's only one-handed. They don't get the full amount of information to make an informed decision.
That it's the first time I've ever heard anybody say that. I think that's really important to think about.
Right. Well, the population that I see, I'm in the Baltimore, Washington area, more in the Baltimore area. I come out and I see homebound patients. I come out and see the patients that don't have access to go out to go see the providers in the hospital. So pretty much back to MacGyver nursing and MacGyver medicine. So trying to bring those services out to them. A lot of people who have Medicare and medical assistance aren't aware that those services are, available to them, that they can have a provider come out and see them in their home. So it's just, when I go and I talk to patients, it's like, I never knew that this option was available. Yes, it's available. Yes, I can bring in as many resources as I possibly can. I can get the labs to come in there. I can get limited x-rays and diagnostic testing done there. But just getting that information out to people, they don't know. And then with the insurance companies, I do have to agree with you on the insurance companies. You have to fight for what you want, because I've had insurance companies tell me no. And I say, well, okay, who am I speaking with? So when this lawsuit comes into play, I can pretty much say exactly who I spoke to, what time, and what your response was. I'd like a provider-to-provider meeting so I can speak with your medical director. And usually then when they see that you're not going to back down, they tend to turn around and say, okay, we can give you what you need. So like you said, fight at all costs for your health. Don't let anybody tell you no. When
Right.
you have that gut feeling that you're right, don't let somebody tell you no.
Exactly. I think that's the hardest lesson, I think, for people to learn, is that the insurance thing is a game, and their default thing to everything is no.
Mhm.
And you have to push back. I mean, they send you a bill, and all the HAP needs is the codes need to change. But somebody needs to call and say, how come I'm getting this bill? And they say, oh, your doctor put in the wrong codes. Okay, fine, I can fix that. But people pay the bill. Most people will pay the bill without.
Just to keep everything calm, and I don't want any problems with my insurance.
Right.
I don't want them to cancel me or anything. Let me just go ahead and pay this. No, question it. Question it, because you can find out so much more when you question it. And like I tell them, I don't know everything. But if I make a mistake, or if I can walk you through with this and we find out that it's something that I've done to make a mistake, then we all learn.
Exactly. And remember, like you said, don't get angry though, because that person you're talking to is making about $18,000 or $20,000 a year, and they're paid to have you yell at them. And the person who loses his temper loses the argument. But I always say, listen, I know you can't do anything. You're not paid. It's above your pay grade. So let me talk to somebody who can answer my question. You know,
I usually let them get angry first, and I usually give them a lovely smile over the phone.
yeah,
And the angrier you get, the nicer I'm going to get.
there you
I'm going to
go.
please and thank you to death till I get what I need. And tell them I appreciate your kindness. Thank you ever so much for all of the attention that you're giving me. But in the inside,
Right?
I'm boiling. But if I displayed how angry I was, how far am I going to get, and what does that solve? Absolutely nothing.
And imagine what their days
Absolutely.
are like. Imagine what their days are like all day long. They have people yelling at them. That's
Mhm.
got to be a horrible job.
Yes, and I just keep referring back to what my mother always told me. Um, you get more things with what is it, sugar with honey than
Yeah.
vinegar. Yeah, I try to
Mhm.
remember that when I'm talking to these people and while I'm praying, Lord, please let me keep my inner beast together so I can talk and get what's best for my patient.
Right.
Because they depend on you to be the pit bull for them. They depend on you to do that. Because
True.
no one else, I know with the population I take care of, the homebound, nobody wants to come out and see them. A lot of my patients live in the inner city. A lot of them live in gang infested areas. So you have to budget your time when you go in there. When I go into a area that they've never seen my car before or anything, yeah, I gotta go through the gatekeeper. And so a lot of providers, they don't want to deal with that. So it's limited what you can do. But I was born and bred in the city. I
Yeah.
love my city. So I gotta blend in, and I know what you need to do to get through those hurdles. But it's just getting the knowledge out to the community. That's what's important, getting the knowledge out. And being a
Yes.
pit bull when you're dealing with these insurance companies, because the only thing they deal with is dollars and cents.
Very
Actually,
true.
that's a good pivot right into some questions that we got. Because the lights, as you guys are talking, the lights were lighting up. All right. So the first question I have is: with the reopening of urban areas, how can we reinforce the education around the virus, aerosolization, and the importance about the mask at this time?
Well, I think, I've seen people write that a mask is a sign of respect. And I think let's face it, we are trying to change a social norm here. At the beginning of the HIV epidemic, when I was training in my residency, we never wore gloves. I mean, you used to run a cardiac arrest with bare hands, and you would have blood up to here, right?
Yes.
And fortunately, none of us seroconverted and became positive, but that was before anybody used gloves. And when gloves came out, people were like, I can't draw blood with gloves. I can't feel the vein. I'm never going to be able to do that. Imagine that now. If somebody said that, they wouldn't get a job. But it took a while to change that social norm so that everybody wears gloves when they draw blood. And so the mask thing is going to take a little bit of time. But I think it really does. Listen, I actually had an asymptomatic infection early in March. I sent a test on myself just to see how long the test was taking to come back. And 12 days later, at that point, it came back positive. Never had any symptoms, maybe some fatigue. I just thought I was old and working too hard. But, and I watched as my virus got less and less, and I developed antibodies, and the virus is now negative. So if antibodies are protective, I don't really need to wear a mask. But I want to make everybody around me feel safe as well. So as I said, I wear that mask as a sign of respect when I go into places. Plus, I can't be sure that the antibodies are protecting us. And I think that's the message that we have to get out there to people. The press is. I have a friend who calls cable news terror porn. It really is. I mean, they all they want to do is keep your eyeballs on that screen 24/7, and so they're frightening the hell out of people. And all they do are the bad stories. All they do are the things that are going to make you scared. They don't talk about the people who are doing things right, and they're not giving people simple things. So if you listen to the news, if somebody coughs 2 towns away, well, it could be hanging in the air, and you might get it. If somebody rides by you on a bicycle, yeah, okay, they cough, there's virus there. But then the question is, how many people are going to get it from that? The same thing with HIV. They used to talk about how it lives on the tabletop. How many people got it from a tabletop? 0. So theoretical possibilities and reality are two different things. So like I said, put the mask on, wash your hands, you'll be fine.
I think also with re-educating people about what the mask is for, because in our communities, we've always been taught that the mask was a form of doing illegal actions. So we're hesitant to put those masks on and go into communities or go into establishments because a lot of the insinuations that people of color are going to do something illegal with these masks on. So those are things that I've also seen and heard. We have to re-educate people that what the use of the mask is for, and we also have to re-educate people on how they look at people of color. Now, yes, in a perfect world, that would be great, but those are some of the things that hold us back. Fear. The main thing is fear, because people are fearful to put the mask on. People they aren't educated on what the virus is. They have been told that Black people, they won't get the virus. It's only for white people. So those 3 things are 3 major things that we need to re-educate our communities on, that we are susceptible. We have a high incidence of diabetes, hypertension, COPD, all of the chronic illnesses. So we are at risk, if not more at risk. Even in the Baltimore area, they had the risk factors in those high zip codes where we had the highest amount of people who tested positive. And then those in the nursing homes as well. It's running rampant in the nursing homes. And the government had no idea that it would be that rampant in the nursing homes, but they didn't really think. Let's think about this. A lot of people in healthcare work 2 and 3 jobs. So it's not mostly the families that may be bringing this in out. It may be us, the healthcare providers, that are bringing it in and out of these communities. So it's a lot of things, eye-opening things that the government and healthcare needs to study as well with this virus.
Well, and let's face it, I think we've seen that a lot of people of color living in places where they can't really socially distance. There's too many people living on top of each other. And a lot of people of color have been in those essential services, whether it's the bus drivers or subway or the meat packers or the, that's, the communities these are communities to step up. And truthfully, as far as the masks go, all the people you see fighting against it are all a bunch of white people. I haven't seen one video with a person of color saying they're not going to wear a mask. And I think the fear you express is real. I think that really has to, because you look at all the people who were, like this new one with the lady with the dog, how many times are you going to be afraid to walk through a park because somebody's going to do that stuff on you? There's something else that I've seen that I just need to check with you guys, because one thing I've seen is that in the community, people I know in communities of color, family is so important that even though they're quote unquote isolating in place, they're still going to see their moms and dads. There's still, one of my medical assistants drove hours up to Panama City in Florida to make sure her mom was okay. And there were a whole bunch of relatives around, and 2 of her cousins died of coronavirus.
Oh, wow.
All the Latino people that I know are making sure that they see their parents. All the white people I know they're leaving them in the nursing home. They just stay away. But it's just a different family dynamic that's happening, and I think that maybe putting people at some increased risk.
And I also
So
think
many nails.
the way that you were raised has a lot to do with it. A lot of brown people of color, think that, we have to make sure we take care of our own because we know no one else is going to take care of them. And we tend to forget that that self-isolating also means that you gotta stay away from mama and dad. Now, my father, 74 years old, acts like he's 24, but that's a different thing altogether. I call him, check on him, make sure he's okay. It's bothering me not to go and see him, but that daughter thing inside of me, I want to go see my daddy. No, I know that it's for the best. Number one, I would put him more at risk because I go out and I see patients out in the community. So I don't want to take anything to him. And that's what I have to remind some of my colleagues. Not that you're isolating yourself or doing some type of disservice to your parents by not going to check on them. You can use Zoom. If they don't have an upgraded phone, upgrade mom and daddy's phone to where they have at least FaceTime. You can FaceTime them and talk to them every day, because that's another thing that I run into. A lot of them don't have adequate technology in the home. So they need upgraded phones, or they need something to go in there and check on their parents or check on those family members. But again, education.
I think that's a great point. I think also maybe in larger families, appointing one person in the family who's going to make sure to do the face-to-face, and that's the only person who goes in, you know, to mom and dad.
Then you have then you have the dueling siblings that who's going to do it, who's going to report to who. I don't trust yet, but that's down the line. But right, report that one person to go in and check on mom and dad to make sure everything's okay.
Yeah, awesome. Thank you all. That was a very interesting conversation. You guys hit a couple of nails in the head. I'm over here like nodding, like yes, yes, yes. All right, so I have a few questions. Can kids get the coronavirus?
Yeah, absolutely, yes. And we're starting to see an increase of a lot of symptoms with the pneumonia, and then the different rashes, ones that's mimicking Kawasaki's disease, ones that's causing the SARS pneumonia in the children, that you have an increase in them being vented. Yeah, I'm seeing a whole lot of that in the hospitals.
I mean, I think what's becoming clear is that this is disease with at least two phases. So there's the virologic phase where the virus is attacking your body. And that's when people first get sick. And people have seen this. They get a fever or chills. They're really, really sick, the worst flu they ever had. And then they feel better for a few days. And then they crash again. And I think that second phase is an immune response phase. It's not the virus, because actually the CDC has 3 unpublished studies where they found that they could not grow the virus out of somebody, no infectious virus, 9 days after that person became symptomatic. Yeah. So the virus disappears, but the effect is still there. And that's when that immune response happens, and that's what's killing people. And the kids are getting that immune response further out. And that's what this new, this new disease syndrome seems to be about, is an immunologic response for kids who didn't even know that they would have been affected. And who knows what else we're going to start to see, because we're starting to see people with blood clots, people with strokes, who never had any symptoms of the virus itself.
Yeah, from what I see, it's a lot of younger folks too are coming up with these, like having strokes and blood clots and things that in the beginning you were told that it was only seniors, but now like it seems like the age group is getting younger and younger as you go along. All right, the next question, actually, Veronica, you touched on it. What is Kawasaki disease, and is it true that Kawasaki disease is linked to COVID-19?
No, it's not, from the research that I've seen. And Howard, you can elaborate on that a little bit more. I haven't seen where Kawasaki's disease is related to COVID-19. From what I've seen in the literature, that they have a rash that appears like Kawasaki's disease.
Exactly.
It is not related to Kawasaki, but it appears like it. But the different symptoms that that person portrays or presents with is usually the determining factor in how treatment is. And that's the basis of treatment, what symptoms are presented, not given everything that you have to use in your arsenal against someone that comes in COVID positive. You have to base it on disease management or symptom management, I'm sorry. But
Right.
no, it's not the same.
But this is why you heard Dr. Fauci say, maybe we shouldn't open the schools so fast, because we were just beginning to see some of these symptoms. They're seeing it in Europe. They've seen some in Asia. There are several children who have died now, and it's an inflammatory disease. So this inflammatory process can hit organs all over the body. So as Veronica said, it looks like Kawasaki's disease. It looks like toxic shock syndrome, but it's not either one of them. It's something else, but with similar symptoms. And the name for it now is multi-system inflammatory syndrome in children. Okay, but this is children. There are cases reported at the age of 20, so the children in quotes. But it does seem to be something that happens 3 to 4 weeks after probably these kids are infected, and
Right.
it can affect the heart, the lungs, the kidneys, the liver. Remember, I said that receptor, that ACE receptor, that this virus attaches to, is on cells all over the body. And so it really, we're seeing, all these, but remember, again, science and development, we're seeing this as it unfolds. So people are freaking out saying, well, you didn't tell us about that before. Well, we didn't know about it before. I mean, this thing is only 6 months old. And there's going to be new information coming out like that we're going to have to deal with.
Yeah, I tell people the same thing. We're learning this every day. We're learning something new because the virus is changing every day. Every week is. So it's not that people didn't know it before. It's just
they didn't know it before because it didn't happen.
It didn't happen before, right? Right. All right. So my next question is, how can one stay safe while flying? If someone has to fly, how can they stay safe?
Well, first of all, the planes are pretty empty. Most of them. We've seen the pictures of planes that are packed, but every time I talk to somebody, I just picked up somebody at the airport yesterday, and he said the plane was from New York was totally empty. So that's number one. Number two, the airlines have very strict rules about wearing masks, about hand sanitation, about what they're giving out or not giving out anymore on the plane. And those are really, they check people's temperature before they get on the plane. All of those things are going to help protect you. And you're in a tube, but the air is filtered. Remember that. So as far as enclosed spaces go, it may be a lot safer than your neighborhood restaurant. And I think people are keeping travel to essential. And the more teleconference, telehealth, everything that we can do, then the safer people are. Bad for the airlines. I mean, you're watching them start to declare bankruptcy. And reservations are getting more expensive and harder to get. That I think for the most part, it's safer to fly now than it was 2 months ago.
Yes.
Yeah, and that's what I tell people. This shutdown wasn't to stop the disease completely. It was to give us some breathing room to learn about it, to learn how to protect ourselves, and to not overload the hospitals. So now, if we start to open things up, we're not the same people we were back in January. These people who are throwing everything away and acting like they're going to put us back into a January situation. But for those of us who are taking precautions and following the guidelines, we're not the same people we were in January.
Absolutely. Absolutely. Thank you. Sorry, that's my dog in the background. Side effects of working from home.
No problem. You may hear mine bark as well.
Okay. So the next question I have is, what can you tell us about this second peak we've been hearing about?
I didn't hear the question.
The second peak?
What can you tell us about the second peak?
Well, number one, with the second peak, I think it's going to be a lot worse because people are not adhering to the social distancing. And I think it will be sooner than later. A lot of people are predicting that it's going to be in the fall. I don't think it's going to be in the fall. I think that this is going to hit us right smack in the middle of summer. And I think that the symptomatology is going to be worse because with anything, it mutates. And I think that it will adapt to any condition that it needs to, and it will be more severe. And it will be worse. It will be worse for healthcare professionals, number one, because we have to, number one, try and find out how to treat this. And as far as they've been pushing out in the news, oh, we have a vaccine. We have all these people who are giving trillions of dollars towards vaccinations and everything. We don't really know all of the symptoms that's presented so far. So how can we be sure that any vaccination that may come out this year will be beneficial for the peak that we're in now, and then the second peak that we're going to get? I think that will happen in midsummer. I don't think that it's going to happen as far as fall. I think it'll be a lot sooner.
You know, I agree with you. I think that the fall peak was based on the assumption that it would stay shut down for longer.
Right.
But the president has clearly rushed this thing through. The way he's rushing everything through, because his whole thing is to convince people that this is temporary, meaning it's going to be over in no time.
No.
And we're clearly in this for 2 years until there's a vaccine. I mean, it takes, remember, I think you're right. You have a vaccine, you need to make sure it works, and you need to make sure it works over time. Well, that takes time. You know, you want to make sure that people who are immunized against it are healthy for a year after they get it. Well, that's going to take a year. I mean, you don't just push these things out the door. And it has to be large studies with thousands of people in them to be valid. So, you know, when they say 18 months, I think they're being really idealistic. Plus, it takes time to ramp up production. You're talking about getting millions and millions of doses of vaccines out, not just for the U.S., but the whole world.
Right.
Otherwise, it comes back. So I think that takes time. You know, but listen, you know, our parents and our grandparents, they lived through the Depression. That was 12 years of suffering. They lived through World War II. They gave up everything for 5 years. You know, we're talking about 1.5 to 2 years here of wearing a mask and washing your hands, you know, and maybe not being able to go to a big concert. And so it's not a lot to ask of people, but you have to make people know it's going to take that long. It's not over tomorrow. So I think you're right, Veronica. The second peak is going to come because people are taking off those masks. They're doing what they did in Missouri this weekend and partying in the lake. And because they think this is temporary.
Right.
So I have another question that just came in from a number of people. I'll just read the last iteration of it. Speaking of summer, is it true that the virus dies in high temperatures?
No.
I know the answer, but I want you guys to give the answer.
No. If you think about where the virus started, it started in China. It's gone to Australia. It's gone to Europe. And now it's here. And you've seen it also in Africa. So I don't think that anything as far as the temperature is going to have anything to do with this virus. From what I've seen and from what I've read, no, that is not, high temperatures is not going to do anything.
And in fact, if you look at a country like India, I mean, India is such a massive place, and it just shut right down at the beginning. And so they kept the cases low. Well, they've been reopening little by little, and their cases are skyrocketing, and it's heating up in India. In another few weeks, this is where it gets really hot in India, and the virus is spreading very quickly. So I think that was a Donald Trumpism.
Right. And even look at now with South America. You know,
well,
Brazil.
it's cold in Brazil right now.
You know, I told early in the epidemic. I heard that temperature thing early in the epidemic, and I tried to explain to people. Some parts of Africa, the day start at 80 degrees. So if it can survive out there, what makes you think 80 degrees here in the United States is going to kill it? But you know. That's just me. Next question.
Can I just, before you go on, there's one other thing with what we were talking about with the second peak, to realize that the first peak, most of it happened in New York. Okay, so the biggest thing was in New York. Well, in the meantime, this virus is spread everywhere in the country, into rural areas where there's no hospitals, into places. You're already hearing from Alabama that the hospitals in Montgomery are overwhelmed. They're sending people to Birmingham. New York had a big medical infrastructure, and still it was a mess. Now you take it to places, now it's spread everywhere, and you're going to overwhelm those systems in no time, the way the Indian Health Service has been getting overwhelmed. So that's a peak too.
Yes, the Indian Health Services, Appalachian Mountains, those in rural Midwest, they don't have the health systems that New York has. So how do we explain that, Mr. Trump?
Right.
You said it, not me. Okay. Well, I have 3 more questions for you all. Thank you again so much. It's been very insightful. It's another, can salt water kill the virus?
No.
No.
Again, I know the answer, but I want to hear from you both.
No. Salt water cannot kill it.
But remember about these viruses, what kills it in a test tube isn't necessarily practical. So I had a friend who used to say, if you spit in a test tube, you could kill HIV. Well, I mean, don't spit in me. Don't spit at me. It's not really a therapy, but that's the same thing with, you could put bleach in a test tube and kill the virus.
Right.
But, salt water may interfere with a virus being able to grow, but it's not going to work in your body.
May inhibit it, but won't kill it.
Yeah, remember,
and
we're salt water. I mean,
right.
Most of our body is water and a lot of salts.
Right, that ultraviolet rays and Lysol is not going to kill it.
Again, you said it, not me.
Not without frying you.
Right.
Oh, goodness. All right, I have some more questions popping up. When is someone with COVID-19 most contagious?
During that they're most contagious when they're asymptomatic. So those first 5 to 6 days, and they're most contagious when in that early symptom days. Like I said, after 9 days, according to people I've talked to at CDC, they can't find infectious virus.
Okay, awesome.
So pretty much like the first 2 weeks.
Yeah, it's really most effective. All right, thank you. I have another question. How important is mental health? Should everyone be seeing a therapist during this time?
If you need to see a therapist, see a therapist. If you need someone to talk to, call that person. Most therapists that I know, they have set up telemedicine for that purpose of being able to have that interaction with their patients, and especially if they really need it. Now, if you're having anxiety and panic attacks every 15 to 20 minutes, you may need to go inpatient to be seen or evaluated. But if, on the whole, most mental health providers have set up telemedicine for therapies for their patients.
So I think it's really important to say that it's completely normal to be depressed with what's going on, to be anxious, to be frightened. Those are normal reactions, but that doesn't mean we have to live with them. And for people who've gone through some of the horrors in New York and things like that, the post-traumatic stress is going to be an important thing. Reach out. I mean, if you're feeling suicidal, call a suicide hotline. If you can't reach a therapist, call a hotline. There are so many of them around, and they're there to help you.
And they'll be able to help you find resources if you need them as well.
And it's not a sign of weakness. It's a sign of being in the middle of a global pandemic.
Yeah, thank you for saying that. All right, I got 2 more questions for you. We're almost out of time. But I don't want to keep you guys too long, but thank you so much. If you feel ill, what should you do?
If you feel ill, the first thing is they tell you to self-isolate. But if you notice, and I usually use the rule of 3, for 3 days, if your symptoms are getting worse, then you may need to reach out to be seen. I have a lot of people who call me and say, oh, I've been coughing for past 4 hours, and it's getting worse. And then I have to ask these questions. Well, you have allergies, seasonal allergies. Have you taken your medicines? Have you done this? Have you done that? And they're like, okay. I said, if it doesn't continue after you take your medicines, contact me back and then we can set up a visit. But you have to notice if these symptoms are getting generally worse. I usually use a 3-day approach with most of my patients, and usually their families are involved to keep me involved with what's going on.
So yeah, I think that's a really good rule. I tell people if you really want to be prepared, you don't need 140 rolls of toilet paper. You need a bottle of Tylenol. You need acetaminophen to control fever. You should have cough and cold medications in the house, just the regular stuff you would take. You should have cough medicine. And if you have high blood pressure, make sure it's the kind that's for high blood pressure.
Right.
And those are the things you prepare. So, so like Veronica said, you try that first and you see if that works. If your symptoms get worse, you call a healthcare provider. You don't go visit, you do a televisit first. You don't go to the hospital right away. But, if you start feeling short of breath, if your fevers aren't coming down, that's when you go to the emergency room. And now the emergency rooms are mostly, at least in our bigger cities, able to take care of you.
Right.
Don't be afraid to go to the hospital. If they think you have the virus, they will isolate you. If they think you don't have the virus, they will put you in a place where you won't get infected. So people are really afraid to go to the hospital when it's necessary. But certainly if you're short of breath, that's when you head to the hospital.
Right.
All right, so last question. What are some other safety precautions aside of wearing a mask, gloves, using hand sanitizer, and social distancing that you recommend that maybe you have done to help keep you or your loved ones safe from being exposed to COVID-19?
You don't need gloves. I mean, I see people wearing the same pair of gloves for a week, they look so ratty and dirty. And if you touch your face with your hand with the glove, it's just as bad as your hands. So, like I said, we know in hospitals and in medical situations, we say foam in, foam out. So you use the hand sanitizer when you walk into a room. You use the hand sanitizer when you walk out of a room. You wash your hands when you get home. And you don't touch your face in between. You don't need the gloves, but the mask, that makes a big difference. If you're sick, don't go to work. Don't go to the market, send somebody for you. If you're sick, stay home. And that means employers need to get their acts together and stop this thing where they penalize people for calling in sick, because they should celebrate people who say, I don't want to infect other people.
Also, like I say with the hand sanitizer, I know there's limits on this hand sanitizer. That's why the liquor stores are open. You have liquor stores where you can get the Everclear, which is the grain alcohol, and you can make your own hand sanitizer. You can use coconut oil, you can use tea tree oil, you can use vitamin E, one part of that, which is one container of that, and then you take 4 parts grain alcohol, put that in the container as well, and you can put several drops of lavender to use that as homemade hand sanitizer. So you don't have to keep wearing the same nasty, grimy gloves, and then gloves are a limited supply. So, but we seem to have a wealth of alcohol. So
The nasty, grimy gloves, the wealth of alcohol. Words to end the session by. Thank you. Thank you both again for joining us and having this discussion. I hope everyone that's been listening on Zoom and on Facebook. Oh, we got another question. If you guys do mind, okay. Do you mind taking one more? People are saying you guys have been great. One more. You have time for one more question?
Sure.
All right. Prior to your response, are those stuff safe for pregnant people if they want to make their own hand sanitizer?
yes,
Is it safe for you to use that?
yes.
Yeah, I don't see why, as long as you don't drink it.
As long as you're not drinking it, not drinking 4
Right.
parts of it, please don't. It's used
It's basically the same as what they make with the regular hand sanitizer.
right.
Awesome. Well, again, thank you guys. This is going to be streamed, or is being streamed live on Facebook. So thank you for all of those that took the time to sit down and watch and get some information, some factual information. I think it's important that we get facts out because, like you said, there's a bunch of stuff coming out of the news, and someone's calling somebody, or someone's posting on Facebook, and you know, people don't know what to believe. So thank you all so much for taking time out of your busy days to really provide some information. If anyone has any questions, please feel free to email me at kenya@lemaisondc.org to the email address that you got your Zoom link to, and I will find the answer, send it over to you all. And again, thank you both.
Thank you
You're
for
welcome.
having us.
Thank you.
All right.
Take care. Bye-bye, everybody.
Bye.
Thanks. Bye-bye.